St. Luke's is keeping up with community health needs in an area experiencing rapid growth.
St. Luke's has been here in the Monroe County area for over 20 years. We have a lot of excellent providers here, and they really asked us to build a hospital to better help care for their patients in the community.
The St. Luke's Monroe campus now meets their need for a full-service inpatient hospital right here in the county. It's easily accessible to Route 33, 80, and 611.
The St. Luke's Monroe campus is the 7th hospital in the St. Luke's network.
We are a network, and being a network, we have a level 1 trauma center. We have a helipad on site where we can transfer patients. It's a very easy communication for me to specialists. It's very easy communication for me to primaries, which is great for the patient because that information seems to flow very easily, and the patient doesn't get lost in that shuffle.
Being part of such a large network, we're able to bring that quality of care that we deliver to our patients up here to the Monroe County area.
Patients are a priority for us every day, and I think it's just overall it's been great in the community too that we can have a place for all these patients to go.
It's so modern and so clean. They treated me with such dignity and respect, with such good care.
You always start with empathy. You put yourselves in their shoes. Why are they here? What can I do to make their stay a little bit better?
That's just St. Luke's way. We just think of the patient first. St. Luke's is committed really to every community we enter.
We have community outreach. We provide screenings to patients in the community. We have affiliations with schools, with local businesses, really to partner with businesses that are in line with our mission, vision, value, and goals.
There's just a sense of we want to be part of that community, we want to grow with that community, we want to serve that community. So keep those patients here, provide excellent care right in their backyard, and be a good citizen of the community as far as giving back and providing the care we can at the best level we can.
Our focus on clinical excellence includes our investment in state-of-the-art medical technology.
I'm very proud to work at a facility that is also the international show site for GE. This is all brand new equipment, and it's much faster than I've ever used before.
In medicine and on a whole, technology is very important, and it makes safer, better patient care for my patients.
Technology is like a tool, and we all know that the better tools that you have, you're able to provide better care to the patients. I got into healthcare to make a difference, and when I stepped on the campus of St. Luke's, I just felt that culture was different. It's palpable.
St. Luke's is a wonderful place to work. You get the experience, the technology, the staff, and you get to focus on patient care all day.
From doctors, nurses, to everyone in between, there's always a nice person I'm going to encounter throughout the day.
The collaboration, the teamwork is above par.
Anyone within the network has the right to say, hey, this is what's right for the patient. And it really just helps the patient. If we all communicate better, it just better facilitates the care.
You're kept informed the whole way, so there was a lot of comfort.
It brings me a lot of pride and joy in that we're able to bring the care that we're known for here to Monroe County, knowing that we have the best employees and physicians.
Once in a while, like you really can help somebody. I mean, you really save a life. It's a great gift. It's a really great gift. You know, if I had to be a superhero, this would be the power I would have.
Joining me in the studio is Joel Fagerstrom. He's the Chief Operating Officer and Executive Vice President at St. Luke's University Health Network. Joel, thanks for being here.
Thank you.
Congratulations. This is so exciting. You've got the 7th hospital in the network just built in Monroe County. Tell me a little bit about the facility, you know, where it was built, what's involved, and what's up there for people.
Yeah, it's a very exciting project for us. As you mentioned, it was the 7th hospital we've built, the 2nd new one in the last 5 years, and we spent the last number of months in design and construction, and we opened it up this past October, and pleased to say that we had projected a certain amount of inpatient emergency department visits, and we've more than doubled that. So
wow, that's incredible.
Yeah, the community has really welcomed us with open arms as we go out and speak to members in the community. They are so happy that we're there and they have an option for the healthcare in that community.
And it's really a beautiful facility as well. How long has St. Luke's been involved in Monroe County? Was the hospital brand new, or was there a relationship prior?
So we've been providing services in Monroe County for well over 20 years, and we provide a lot of outpatient services, and as we continued to grow and expand and align with more and more physicians, it was actually the physicians that asked us to start an inpatient hospital up there, and and the citizens of Monroe County have welcomed us.
They must have felt there was really a strong need.
Yes,
if
very
it
much
came
so.
from the doctors.
And, obviously, that need has been fulfilled because our volumes are really incredible.
It is amazing to see that there have been 2 new hospitals built within St. Luke's system, and now there are a total of 7 within the network. How does that work? In your capacity as the Chief Operating Officer, what are some of your roles and responsibilities to make sure and ensure that the communication and all the plans are executed properly among 7 different hospitals?
So it's not an easy thing to do, but we have our main acute care hospital in Bethlehem, and then we have smaller and medium-sized hospitals throughout the region, and we try to make sure that we provide as many services as we can in the local community. So, for instance, our smaller and medium-sized hospitals, if they weren't part of the network, they would not have the specialists that we've been able to bring there, and a lot of the services, both outpatient and inpatient. Our patients really enjoy that because they can get most of their services close to home, and if they need to go for higher end care, they can come to Bethlehem or Allentown or Anderson campus to get those services.
It is nice to know that there's such localized care within a larger network, but what about regionally? How do you provide regional care, and how do you decide what stays local and what maybe has to be cared for in a different way more regionally?
So let me give you a good example. So we have what we call the Regional Breast Center. And we decided that we would bring our physician experts, our technical experts to one location and provide the best breast health we could provide for the community. And so we brought all those resources to one location. It's really been, I think, a great service for women in the community. My mom had breast cancer twice. And the most difficult time for her was the time from which she had her biopsy until she found out she had cancer. Both times. And it was very, very difficult. And it was a number of days before she got that answer. And one of the great things that we've been able to do at the Regional Breast Center is we've been able to shrink that time down to a very short period of time, probably you compare best to some of the best in the country. So very proud of the fact that we've been able to provide those kinds of services.
And a great example how having regionalized care is sometimes preferred over local, and how great St. Luke's can offer both.
Yes, yeah, it's worked out very well.
Well, 7 hospitals, 10,000 employees. What's next for St. Luke's University Health Network? What can we expect to find? And how do you maintain that St. Luke's culture and feel throughout this big network?
So a lot of good things happening at St. Luke's. I'm excited for the future. We'll continue to expand our services, both inpatient, outpatient. One of the things we've been concentrating on for a long time, it's part of our mission, and that is to make services easy to access. So we've done a number of things over the last year or two to really expand services and make it easy for people to get access to us. So we have a number of urgent care centers. We have 8 right now, and we plan to more than double our urgent care centers over the next couple of years. All of our primary care and specialty offices now have evening and weekend hours to make it easy for folks who might be working during the day and can't get to the physician's office. We have a phone app, which I love. I've used a number of times, called St. Luke Care Anywhere. And it's a way to get access to primary care physicians 24 hours a day using your phone, your computer, your iPad, and it's been very successful. So a lot of things like that we've been working on to really make it easier for patients to get access to us.
Well, it's pretty amazing. There's no excuse not to get checked out by a doctor if you need
right.
one. Excellent. Joel, thank you so much for being here. I appreciate it.
Thank you.
For more information on St. Luke's University Health Network or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember, every day is an opportunity to be your best self. This is The Peak.
If you like that video as much as I did, make sure you give us a thumbs up and subscribe below.